My name is Dr. Gayathri. I am here at Smriti College of Pharmaceutical Education to teach you pharmacology. So, the first unit is cardiovascular drugs. So, before understanding cardiovascular drugs, we have to understand the structure of heart and how it functions, so that we will be able to understand when in a disease condition, what goes wrong and why certain drugs are used. So, the first topic is hemodynamics of heart. Hemodynamics, when we hear the term, it means hemo means blood and dynamics means movement. So, hemodynamics means movement or flow of blood. So, because we are studying the hemodynamics of heart, we are going to study the flow of blood in heart. So, before understanding that, we need to have a clear picture of the structure of heart. So, when we look at the heart, there is a right side and then there is a left side of the heart, and it has four major chambers, that is right atrium, right ventricle, left atrium and left ventricle. And then there are a lot of blood vessels that go in and out of the heart. So the first one is superior vena cava, which is on the top, inferior vena cava coming from the bottom, and then we also see pulmonary artery, pulmonary veins. So apart from this, we also see systemic aorta. So, and after seeing the structure of the heart, we also see certain structures present in the heart that are called valves. So there is a tricuspid valve present between right atrium and right ventricle, and there is a pulmonary valve present between right ventricle and pulmonary artery, and there is a bicuspid valve or mitral valve present between left atrium and left ventricle, and then there is aortic valve present between left ventricle and the aorta. Apart from these, we also see SA node and an EV node, and Purkinje fibers and his bundles are also present on these parts of the heart. So once we understood the anatomy of heart, we can also understand how the blood flows within the heart. So the blood comes to the right atrium. So I have, in order to make it clear for you, so I have designated the blue color for deoxygenated blood and the red color for oxygenated blood, as I have mentioned over here. So the right side of the heart deals with the deoxygenated blood, that is impure blood, and the left side of the heart deals with the oxygenated blood, that is pure blood. So the right atrium is what first gets the deoxygenated blood from different parts of the body, and then from there the deoxygenated blood goes into the right ventricle. From right ventricle through pulmonary artery, the deoxygenated blood goes to the lungs. So the pulmonary artery, if you can see, there is one branch which is going to the left lung and the other branch which goes to the right lung. And then the blood gets deoxygenated in the lungs, and from there the blood returns into the left atrium through pulmonary vein. And these are also, we can see the pulmonary vein, one goes to the left lung and then the others goes to the right lung. And then from left atrium the blood enters into the left ventricle, and from left ventricle the blood enters into the systemic aorta, and then from there the blood is distributed to the rest of the body. So when this is the basic cycle of the blood flow in heart. So when we come to the, so this is how I have designated it. But then when the blood is moving from right atrium to right ventricle, there is a valve present over here, there is a valve over here. So what are these valves? What is the function of these valves? So we can see that these valves are nothing but they act as doors between different chambers. So these valves can be divided into two types, that is atrioventricular valve and semilunar valve. So what is the function of a door? So as long as the door is closed, everything inside is contained, and when the door is open, the things from inside go outside. So in the same way with these valves, when these valves are closed, the blood is contained within the chamber, and when they are open, they move out. So there are two types of valves, as I have told, atrioventricular valve. So from the name itself we can understand that these are present between atria and ventricles. So these are two valves, that bicuspid valve or mitral valve which is present between left atria and left ventricle. So in the name we hear a term called cusp. So what is that? So bicuspid valve has two leaflet-like structures. Tricuspid valve has three cusps, that is three leaflet-like structures. So the bicuspid valve is present on the left side of the heart and the tricuspid valve is present on the right side of the heart. So apart from that, we also see semi-lunar valves. Semi-lunar valves are present between ventricles and arteries. So these are pulmonary valve and aortic valve. So this pulmonary valve is present between, as you can see, right ventricle and pulmonary artery. And then aortic valve is present between left ventricle and aorta. So semi-lunar valves are present between ventricles and arteries. So pulmonary valve is present on the right side of the heart and aortic valve is present on the left side of the heart. So once we understood the function of these valves, we also should know what are the different parts or what are the different blood vessels that bring deoxygenated blood into the right atrium. So these are three different blood vessels. One is superior vena cava. So from the name itself you can see the term superior. So this brings the blood to the heart from head and upper parts of the body. And then inferior vena cava. This brings the blood to the heart from lower parts of the body. Apart from that, we also see a coronary sinus. What is this coronary sinus? This coronary sinus is a collection of vessels that comes together and collects blood from the heart, that is from the coronary vessels, and brings it to the right atrium. So this collects the deoxygenated blood from the coronary vessels and brings to the right atrium. In the same way, the oxygenated blood also leaves the heart into three different parts. One is to the upper extremities, the other is to the lower extremities, and also a portion of the blood goes back into the heart for providing oxygen to the cardiac muscle cells. So we also see one peculiar thing in this blood flow. So as we know, all the arteries in the body carry oxygenated blood and all the veins carry deoxygenated blood. But only in the heart we can see that pulmonary artery is the only artery in the body that carries deoxygenated blood, and then pulmonary vein is the only vein in the body that carries oxygenated blood. So this is something which is very peculiar about pulmonary artery and pulmonary vein. So apart from that, when we hear the term the blood is moving from one chamber to the other chamber and then through the vessels. So how does this whole thing happen? So we know that when the blood enters into the right atrium, there are two nodes present over here. There is an SA node and there is an AV node. So what does the SA node do? So when the blood enters into the right atrium, what happens? At the same time, when the deoxygenated blood is entering into the right atrium, oxygenated blood is entering into the left atrium from the previous cycle. So because of this income of blood into the right atrium and left atrium, the SA node gets activated. So what does the SA node do once it gets activated? It does two things. It activates AV node and also it causes contraction of right atrium and left atrium. So when this contraction occurs, the valves which are present over here, tricuspid valve and bicuspid valve, they open and allow the blood to flow into the ventricles. So along with that, when the AV node is activated, it activates the Purkinje fibers and the His bundles which are present in these parts of the heart, and then this AV node which is activated activates these structures and they cause the contraction of the ventricles. And once the ventricles are contracted, these valves, the semilunar valves open and the blood goes into the pulmonary artery and aorta respectively. So this is how, in a brief way, we can understand why and how the contractions happen. So in the next class, we will see about the heartbeats and also the electrophysiology of heart. Hope you all understood. Thank you.